Hello everybody, I'm Dr. Syed Mujahid Hussain, consultant pediatrician practicing in Bangalore, and I'm here to answer a few queries and concerns about corona. We've been receiving a lot of queries of late. Number one, what is novel corona? It is called as novel because prior to 2019 December, it was never found in humans. It is new to humans, hence the name COVID-19. And what is the source of corona? Earlier, initially, it was believed that it probably came from contaminated meat or poor handling of meat, etc. But later on, when they realized that it is basically from human to human transmission, it is going from person to person, so that thought has been considered as doubtful. What are the symptoms of corona? Now, corona is just like any other viral illness. It can have fever, maybe on the higher side, 100 to 103 degree temperature, dry hacking cough. There's no mucus, there's no congestive cough in corona. There may be body pain, there may be tiredness, there may be gastrointestinal symptoms like vomiting, loose motions, etc. So again, if you have these symptoms, do not panic. It can still be any other viral illnesses which is also going around in the community. Kindly meet your physician, your doctor, if it is beyond 3 days, just to be on the safer side. Now, someone asked me if somebody is infected with corona, will or he or she die? So let's understand statistics here very clearly. Out of 100 people infected with corona, 85 of them recover very well with simple or subclinical symptoms like throat irritation, little bit of cough, and even nothing for that matter. 3 days, 4 days, they recover on their own. Many in the society, we don't even know whether they have corona because they have recovered on their own. Now, remaining 15%, let's say about 12 of them might develop complications of corona. So what are the complications of corona? There might be basically pneumonia, they may have lung infection, some of them may develop liver infections, renal infections, urinary tract infections, some of them may develop a mild sepsis. They may require, this category may require hospitalization and treatment with some basic antibiotics to prevent secondary infection, supportive medication, so on and so forth. Now let's come to these three who are very critical. These three might develop next level of complications like multi-organ failure, like severe septicemia, like meningitis, like renal failure, like bad pneumonia and respiratory failure. They may go into the ventilatory mode, they may go into severe ICU care. Now, these are the cases which are prone to fatality, which we might lose, which may succumb to corona. Now, again, these 3%, three of them, most of them are above 65 years, immunocompromised, who have any comorbid condition, basically underlying conditions like diabetes, long-standing heart conditions. They already have lung conditions. They are already on medication which basically alter their immunity for certain health-related conditions. Pregnant women are the high-risk individuals, right? So, statistics is 2 to 3% is the death rate. That is what has been reported in China and all over the world. So if you take out the data and read, so people who have died they come into this category or the category which I mentioned about health related issues, right? So someone asked me what is quarantine and why it is for 14 days. The quarantine is basically done to people who have been suspected to have come in contact with corona infected patients. You understand? So these people who have had a travel history and all that, they basically are kept in quarantine for 14 days. Why 14 days? Because the incubation period of corona is 14 days. That means after 14 days, corona dies off. It multiplies for 14 days, it can still infect. After 14 days, the person is released from the quarantine center. He or she is safe. They cannot infect anybody. Now, can corona come through food? There is no data with CDC or WHO that food can contaminate. Food can be a source of corona. So well-cooked non-vegetarian food or any food for that matter is safe. It has no risk of transmitting corona. Can warm weather stop corona? Hot weather, again there is no evidence, there is no data because there have been cases reported from countries having hot climatic conditions, hot weather, humid conditions, still hasn't stopped corona from spreading. So it is still a doubtful belief. Now someone asked me how to protect myself. Very well asked. Basically, you have to take care of yourself. That's the most important thing. Hand hygiene is very, very important. Now, I have said this in my earlier videos also. Hand wash alone, simple habit of hand wash has prevented 80% of infections, has been doing it. Okay, So hand wash 20 seconds with liquid soap thoroughly on all the surface of your hands. How to do it? You can watch any YouTube video. There are hundreds of videos as to how to hand wash for 20 seconds. Right? If you do not have an access to liquid soap, kindly use sanitizer with at least 60% alcohol in it. Otherwise, it is useless. Right? Who are these high-risk individuals? I just mentioned to you, people who are about 60-65 years of age, diabetes, hypertension, chronic conditions, pregnant women, they need special care. They need to be protected very well. They should avoid crowds. They should avoid public gathering. They should avoid going out unnecessarily. They should hydrate themselves well. They should stay indoors. And again, hygiene is very important. And along with hand hygiene, let me also stress on respiratory hygiene. When you cough and sneeze, do not use your palm. Kindly use your elbow to block it. And once it is done, again you can wash your hands, because your palm can, again, you can infect others, you can spray it all over everybody, right? If you're using tissues, discard every time you use a tissue, right? Now, very important big question, face mask. It's $1 million question now, because it is being sold in millions of dollars, face mask. Now, should I wear a face mask? No. If you do not have any infection, if you do not have any symptoms of any viral illnesses, do not wear face mask, okay? And only if you're infected, only if you're showing some respiratory infection, signs of infection, you can wear a face mask. Face mask is basically recommended for people who are healthcare professionals, who are taking care of suspected corona cases, or even otherwise at a healthcare arena. Now, if someone is tested negative for corona, can he still have corona? No. If someone has been tested negative for corona, he might be suffering from any other viral illnesses. Most likely he does not have corona, so no need to panic. And coming to the testing part of corona, in India currently there are about 52 testing centers all over the country. So just because you have these viral symptoms, don't rush to these centers, or don't rush to doctor and pester him to conduct tests for corona, because at this point in time, 1.3 billion population, the testing centers are limited. They cannot handle the burden. So don't panic. Visit a physician or doctor, understand the symptoms and signs about it. Now, a lot of racial stigma. Corona came from China. Every Chinese is infected. Every Northeast, every Japanese infected. I don't know, so on and so forth. People are talking absolute bullshit. People who are basically spreading this racial stigma and all this negative propaganda, I would say people who are not aware of it, who are not informed, who are ignorant. Kindly understand, corona is basically unbiased virus. It can affect anybody with any race, caste, creed, religion, doesn't matter, gender also, right? It has nothing to do with race or Chinese population. So if someone is infected with corona, can he or she handle pets? Well, as of now, again, there is no documented evidence of corona being found in pets or animals. So still, they recommend, CDC recommends that basically if you have suspected corona or any other symptoms, kindly avoid unnecessarily handling of pets. So basically keep a distance about 6 feet from people. Someone who is infected, definitely have to avoid going out unnecessarily, avoid traveling, and too much of panic now, unnecessarily hype, unnecessary exaggeration. Understand the statistics, understand how many people died and why, how they died, and what are the age group, what are the other conditions they had. One of the Spanish football coach died. He was 21-year-old. The media reported saying he died of corona, but in fact he had leukemia, underlying leukemia. Of course, when there is an underlying immunocompromised infection, illness, any infection can make it worse, and your mortality will be exaggerated, will be basically expedited, right? So understand the underlying issues first. So kindly do not spread negative messages in the society. Kindly do not forward all the WhatsApp message you receive, right? Awareness is very important. Learning is very important. Hygiene is very important. Now, hydration is very important. Take a lot of vitamin C. Take a lot of citrus fruits. Take all kinds of fruits and vegetables. Well cooked food is important. Avoid eating roadside food, definitely. And good news for parents, children have been found to have a better immunity for corona. In the sense, children are still vulnerable. You have to take necessary precautions for children as well. But children who have been infected have recovered very well, right? So the immunity has been proved to be little better, on the better side. But do children need to wear face masks? Not necessary, not really, not required. Parents, don't force a face mask on your children. Okay, again, if you also are having some illness and you're not able to face mask because of breathing issues and all that, don't worry. Strictly maintain respiratory hygiene, hand wash, and covering your face when you cough and sneeze, right? Most importantly, do not panic. Please understand, it's a lesson for the society, it's a lesson for the world about hygiene, about wellness, about cleanliness, about healthy food, about basically being responsible in the society and spreading message of peace, harmony, and staying away from negativity. All right, thank you so much. I hope I have answered most of your queries. If anything is there, please feel free to send me the queries. Thank you so much.